Hi, everyone. Welcome to week one of Professionalism, Regulation, and the Profession. This mini lecture provides an intro to the course content, and it's an overview of the characteristics of profession, professional socialization, the professionals groups, associations, and regulatory bodies, particularly nursing, and an intro to ethics and the law. These slides should be used as a complement to the readings and any other learning activities. Before we learn about professional obligations, let's review what it means to be a professional. What defines a professional? In the learning activity this week, there are 3 examples that should stimulate your thinking about what it means to be a professional and what it means to be an expert. Are these the same thing? So let's take, for example, Vannie Harry. I did not know her. I don't know if I'm saying her name right. She has a book called, or a program called, The Food Babe Way. And this is a diet, a lifestyle that can help make you healthy in 21 days. And I'm sure that already is making some of you question her as a professional or an expert. But she's an author, an activist, and a marketer who criticizes the food industry, and she's been considered an expert by many people. She has no formal scientific training, and yet she makes claims that, while not harmful, sometimes can be misconstrued. So is she an expert? Some think so. And when we think about registered nurses, there are 2 that are included in the learning activity. One is Leah Butmer, who is an RN who discusses her experiences of nursing and why she chose the profession. She would definitely be classified as a professional, but is she an expert? Am I an expert as a registered nurse? Well, sure, in some areas, maybe. And then there's Christina Balin, and she, like many, portrayed herself as a nurse, but she didn't have any credentials. She carried out nursing tasks and skills even though she wasn't qualified. So she's definitely not a professional, but could she be considered an expert in the tasks that she was doing? So what's the difference? Who is an expert? By definition, an expert is someone with extensive knowledge or ability based on research, experience, or occupation in a particular area of study. A professional is someone who works or earns a living in a profession. So an expert isn't necessarily a professional, but a professional can be an expert in a particular field. In short, a professional is someone who earns a living in their profession. But what are the characteristics of a profession? Well, a profession has a unique body of knowledge, theories that are identifiable that belong to that profession alone. So we want to talk about a unique body of knowledge. And this is one of the most widely acknowledged characteristics of a profession. The knowledge of a profession is well organized around theories and is largely intellectual. Profession also has relevance to societal values, and it's organized around something that's important, something vital to human and social welfare, something society as a whole cares deeply about. And as nurses, we care for people when they're ill, when they're in transition, and this is obviously a role that's important and vital and valued by society. So if you imagine a world without nurses, you'll recognize that we really are vital. A profession also has typically a long and specialized educational requirements. So some sort of formal, in-depth, specialized education that's usually at institutions of higher learning. A profession is also motivated to serve the needs of the community rather than its own self-interest. Service to society is an area where nurses do excel. Nursing provides something vital and often to groups that are unable to meet their needs in other ways. Let's talk about the influences on the nursing profession. So first, there's historical influences like the theorists that came before us. And when you think about societal attitudes, think about things like the Christian values of loving thy neighbor and how significant they were on the influence of the development of the nursing practice. And the war highlighted the need for nurses in society. When you think about cultural influences, think back to when society thought of nurses as handmaidens and compare that to where we are today. Or think about how we used to be solely a female profession and look at the diversity that you see across nursing today. Educational influences have certainly changed even over the last 10 years, even over the last 2 years. And when you think about how that training has changed from learning in hospitals to formal education in university settings. There's constantly nursing research that is evolving and influencing nursing. Professional groups and regulatory bodies like the College of Nurses of Ontario, the CNA, or the Registered Nurses Association of Ontario, they help to develop nursing as well as the socialization processes. Professional socialization refers to the acquisition of values, attitudes, skills, and knowledge pertaining to a profession or a subculture that you may already have noticed, such as when you ask a nurse what they do, they'll rarely say, I work as a registered nurse. Instead, they'll say, I am a registered nurse. And this isn't just nursing. You'll often hear that from teachers as well as some other professions. When you leave your shift at work, you rarely are able to take off your nursing hat because nursing as a profession becomes part of who you are. You're socialized into the profession, and you've probably already started to see that when you tell friends that you are a nursing student, they'll often ask you to look at something or ask you for some sort of health advice. So it's proposed by Ware, and that was the reading from this week, about what are the basic social processes that developing a professional self-concept of a nurse in a baccalaureate program. What is the basic social process of developing a professional self-concept of nurse in a baccalaureate program? It's probably what you're trying to figure out. So let's talk a little bit about developing self-concept. The first step is taking it all in. And what Ware discovers and talks about is that to develop a self-concept of nursing, the student first builds on the foundation of any previous life experiences. That becomes your starting point. Then you build on that based on a number of influences or priorities that become the foundation, and it includes maybe information that you learned in previous education experiences or from a past job, maybe even from your own experiences in the healthcare system. Taking all of that in and building on those experiences, taking that knowledge from a variety of sources and then adding it to your foundation, internalizing it, and absorbing each new experiences. These experiences may include, again, your own experiences of maybe watching a family member who required care, or yourself as you were cared for by a nurse. Other key features that are taken in to build on that foundation include the culture of nursing and the culture of the nursing program that you attend, the faculty that you are working with, your clinical experiences, your clinical preceptors, the clients that you see, how they appreciate you, their reactions, even scenarios or case studies that we talk about in courses and classes, assignments and projects, even taking tests and textbook reading. This all becomes part of taking it in. And it's important to notice that each student in this program and every program will just develop their own self-concept based on their own unique backgrounds. So no two self-concepts will be exactly alike. Yours is unique. And let's talk a little bit about the processes of professional socialization. Again, coming from the Ware article. And Ware describes two approaches to socialization The first is the functionalist approach, and you can think about that like a sponge. So there's a consensus among practitioners, students, and faculty that everyone should practice the same way whenever you are looking at this from the functionalist approach. Students are considered relatively passive recipients of the education and socialization experiences of the professional school. Think back to your first and second year and how you were taught. You were taught one specific way of performing an assessment or other skills, and then you performed these skills and assessments exactly how you were taught to do them because you were new and you accepted this teaching as the way that things were done, and as though it were the right way to do it. And that's different from the interactionist approach. The interactionist approach, on the other hand, is whenever you're a nurse that's becoming more active and creative, rather than merely responsive to the cultural or the internalized norms. So therefore, these roles are continuing to be revised, and during interactions, looking back at our example from the functionalist approach, you're now in your final term before your IP, and you've had several hospital or other practical experiences, and you may have found different ways of doing things. You've gathered other information from clients or preceptors that doesn't include using old carts, for example. I'm not familiar with old carts, so somebody's going to have to tell me that. But I can certainly see in my own experience that things that I did whenever I was a new nurse, I was doing because I thought this is the way to do it. I worked for a long time in breastfeeding support in postpartum and in the community, and this is the way that you hold a baby. Your hand goes here, you attach it, you open it. This is the way to do it. And then over the years, over 22 years of doing it, now I realize there's so many different ways that I can do it, and I'm very intuitive in my approach to it now. So that is more of an interactionist approach. So this is definitely something that happens. It's more of a real world approach to things where you realize that there's not one single way of doing things. So Ware also talks about the phases of socialization, and to identify where an individual is in the sociological realm of their profession, as well as to predict the growth, it is useful to understand the processes of occupational socialization from a sociological perspective. As discussed by Ware, there are 4 phases of occupational socialization. The first phase is career choice. And for example, you have all decided to go into nursing school. You chose this career and you chose to pursue this. The second phase is anticipatory socialization, where you begin to learn different aspects of the career before entering into it. So this is currently where you are as a nursing student. You're thinking about where you might want to be applying to post-graduation. The next phase is conditioning and commitment. You've learned the ups and downs of the profession and you remain committed to it. Maybe you don't like the unit you're on, maybe you don't like the area that you're in, but you know that you still want to be a nurse. So you can make changes, but you're staying in the profession. And finally, there's continuous commitment, where you remain committed to the work even when there are problems or other alternatives arise, because you became a nurse for a reason. And while there's some difficult days, and there are difficult days, you remember why you came into the profession and you remain committed to it. Not that leaving is a problem. If you need to leave, that's okay too. But this is about the process of socialization to nursing. Another part of being a professional is having a moral code that guides our behavior. And that's the study of ethics. It allows us to recognize and evaluate things that influence our moral decisions, obligations, our character, our sense of responsibility, social justice, and the nature of the good life. It's a systematic exploration of what is morality, what is right and wrong. Social justice is promoting a fair society by challenging what's unjust and embracing diversity. And we'll talk lots more about that throughout the term. So Why should we be studying ethics as nursing students? Well, first, it can help nurses to uncover to what extent a problem is an ethical one. The question faced in practice can be empirical, it could be formal, it could be philosophical, and often a practical decision requires us to think about all three of these types of different practice issues. In the example of a do not resuscitate order, deciding on whether such an order is appropriate requires us to answer some empirical questions, such as how likely it is that the attempt will achieve success. It requires some formal questions, whether the law even permits us to carry out such an order in the present circumstances. And finally, it requires us to answer the ethical, philosophical questions about how we should weigh in on the quality of life versus the quantity of life. And studying ethics can enable practitioners to develop the skills, the tools, to tackle these ethical and philosophical questions during this period. And learning about ethics can help practitioners to develop the soundness of ethical values and beliefs. And all ethical reasoning requires us to use our values, our beliefs, and attending to them enhances the quality of our reasoning. But is ethics education enough? Will studying ethics make sure that you practice ethically? So let's talk a little bit about that, about ethics education. Ethical education should not lead to ethical action. However, ethical problems and misconduct tends to occur most frequently in fields where ethics is more emphasized. There is a difference between the knowledge of moral values, theories, ethical principles, and codes, and then applying them to professional life. So that is that there's a difference between knowing what's right and doing what's right. So does that mean teaching ethics is useless? Well, I hope not. Otherwise, I'll be out of a job. And the answer is absolutely not. A knowledge of ethics helps you to analyze what's good and what's right for individuals and for society. It prescribes what ought to be done or how we ought to be doing things, provides rationale, objective guidance to practicing ethically and analyzing ethical problems. It helps develop moral reasoning and critical skills, and it is an imperative of nursing and as a profession to be involved in some of those large ethical issues. And I hope we get an opportunity this term to talk about some of those big things that are going on. Certainly Roe and versus Wade being overturned in the US is one of those big issues where nurses are weighing in heavily on what is right from our perspective. So is ethics education enough? Well, no, it doesn't really fill the gap between knowing what's right and doing what's right. Because practicing ethically also depends on an individual's pre-existing beliefs, their attitudes, personal consciousness, their past experiences, and cultural characteristics. It involves different cognitive and psychosocial processes. It also requires support from friends, from colleagues, and from government systems. So all of these things will come into the difference between knowing and doing. And nursing has evolved into an autonomous profession, resulting in increasingly complex ethical challenges for nurses within the context of more sophisticated and collaborative healthcare practices. So there's multiple accountabilities which we have, including knowing and being familiar with the law, the ethics, the ethical theory, the workings of the Canadian legal system, which we will talk about lots during this course, the practice of the practical technical skills that we need to know, and the reasoning that we need to have, and the knowledge to be able to practice these confidently and safely. We also need to have the willingness to ask questions, to speak up when necessary, such as being able to identify when a task is beyond your scope of practice, or what to do whenever you witness somebody practicing unsafely. Finally, documentation, for example. Documenting needs to be done in a timely fashion, and your documentation needs to be succinct, clear, and accurate. A component of being in a profession is that society affords you certain rights and privileges. So rights such as being able to refuse unsafe work and the privileges of the respective society. On the opposing side, however, society holds these professionals to a higher standard of professional, moral, and ethical competence. For example, society expects that practicing nurses know how to perform their job competently. The law is the base that attempts to strike the balance between these two competing theories. So why should nurses need to know the law? Some of you may be familiar with the story here of Alex Wubbles, who was arrested for refusing to draw a blood sample for police on an unconscious person in the emergency room that she was working in. She knew the law, she knew her hospital policies that governed her practice, and this is what ultimately, this is why she was able to act in the most ethical and moral way. Even though she was arrested, those charges were later dropped. She did refuse to take the blood on an unconscious person. And if you click on this link, you can watch the video of the police officer forcing her to do it and her giving the rationale about these are the situations and the cases in which I can do it. And you do not feel that they were not filling that need for her. It's an incredible story. If you haven't heard it, I really encourage you to click on it. Okay, this is a long, boring slide. I'll try to go through it really quickly just to get to the important parts, but nurses are faced with complex situations that are rarely black and white. In fact, I would say they are never black and white. There are laws that regulate nursing education, our licensing, the scope of practice, employment contracts, our professional rights and duties and responsibilities. It's important to have an understanding of these laws. As professionals, we are responsible for knowing our professional requirements, our standards of practice, our professional knowledge and skills, and not being aware of this or having ignorance towards these requirements is not an excuse for negligence. In fact, that could even lead to it should lead to disciplinary actions. We also have access to drugs that are heavily regulated, and we also have laws surrounding the use, the prescribing, the dispensing, and the handling of these drugs. Several procedures also need to be followed when we're administering these medications to clients for their safety. And we're responsible for protecting our patients, the rights of our patients, and this should influence our everyday actions as nurses. Lastly, we've been able to access confidential information, and there are definitely many, many cases where nurses have breached confidentiality that have led to serious consequences, and these even include accessing personal health information which they had no reason to look at. So for example, even looking at your own medical chart on a health unit is not allowed because you don't have any need to look at it. So there are definitely cases where it's been something that seems so benign where nurses have done that and other health professionals and had some significant negative outcomes as a result. When we compare the law to ethics, there definitely is a difference. So think about this. Laws are external to oneself. They're imposed by an outside external body. And it's important to obey the law because if you don't, that could result in harm towards people, or it could end in punishment. Ethics, on the other hand, is internal. It's imposed from the inside, and it pertains to our values, our beliefs. Ethical actions are taken, not because a person is afraid of being punished, but because it's the right thing to do. And I think it's also important to know that people will have different ethics because they are internal, The laws are always the same, but just because it's a law doesn't mean that it's the right thing. So let's talk more and think more about that throughout the term, because nurses are involved in changing laws that often need to be changed. Let's end with just going through a couple of case studies. I'm just putting these forward so that you can think about them. And next week, when we have our drop-in, we can talk a little bit more about what this means. So case one, you're working as a nurse on an inpatient neurology unit, and you have a patient with dementia that constantly is using the call bell. Just for days on end, it's constantly using it for every little possible reason and for no reason at all. And this is interfering with your ability to care for your other patients. So what do you do? And is there a difference between what you would do ideally and what you would do in practice? It's not uncommon where nurses and other health professionals have removed call bells in these situations, and you can absolutely think about the danger of doing that, of removing the call bell. You can think about the ethical implications of that. Certainly there are many problems with that. But think about what you would do when you're a busy nurse with many patients that need lots of different nursing actions done, and how would you work with this nurse? In case two, your coworker comes to work hungover, and they're clearly exhausted, they're disheveled, they still smell like alcohol. What would you do in this situation? And what would your actions depend on? How would your actions be impacted if this was somebody that you have a personal relationship with? If this is somebody that you maybe don't get along well with? Are there different ways that you would respond to it? And the answer is yes. And ideally, there's something that you might do. And there's also consequences to all of the decisions that you make that then make this a harder decision to make. So these are the types of things that we're going to talk about throughout the term, and I look forward to chatting with you more. I'm going to leave you with this quote: "People of character do the right thing, even if no one else does, not because they think it will change the world, but because they refuse to be changed by the world." And that's a really nice quote, but then it got me thinking that what is right for one thing might not be right for somebody else. So sometimes we do need to be changed by the world as the world changes. Lots to think about. I hope that you really are getting excited about this course and that we have a great time together.